Young people aged 15 to 24 have the highest rates of substance use disorders, making them especially vulnerable. Genetics also play a role. If someone has a close family member, such as a parent or sibling who struggles with addiction, they are more likely to face similar challenges. The environment a person grows up in can also increase risk. Living in a home where substance use is normal or where there is abuse, neglect, or poor communication can make addiction more likely. Peer influence is another strong factor, especially for teens who may start using drugs or alcohol because of pressure or encouragement from friends. Mental health can play a major role. Those who experience trauma, stress, or loss without proper support may turn to substances as a way to cope. All these factors can combine to raise the risk of addiction, especially for young people.
National helplines like SAMHSA, Substance Abuse and Mental Health Services Administration, provide 24/7 support and can connect parents with services in their area. There are a lot of resources for parents struggling with addictions and wanting to recover to help their kids. Support groups such as Al-Anon and Nar-Anon are also valuable, offering a space for parents to share experiences and gain strength from others facing similar challenges. Additionally, family therapy can help parents cope with the emotional impact of addiction while learning how to support their loved ones through recovery. Online resources and therapy apps can be convenient for those unable to attend in-person meetings. Seeking professional advice and support networks can help parents navigate the complexities of addiction and its impacts on the family.
Parents should seek support for themselves when they notice signs of addiction affecting their daily lives. Warning signs can include using more substances than intended or being unable to stop, neglecting responsibilities at work or home, and experiencing mood swings, anxiety, or depression. They may hide their substance usage or need to use more of the substance due to their increase of tolerance. Show poor hygiene or changes in appearance, withdrawal from loved ones, or face financial or legal problems. If a parent notices these symptoms in themselves, it's important to reach out for support. Help is available through various services such as Kids Help Phone, drug rehab services, CAPSA peer support, Families for Addiction Recovery, and Smart Recovery, all of which offer guidance and resources for managing substance use and beginning recovery. Seeking support is a strong and positive step, not only for the parent's well-being, but for the health and stability of the whole family.
Addiction often transfers from parents to children due to a mix of genetics, environment, and emotional factors. Research shows that certain genes can affect how a person's brain responds to substances, making them vulnerable to addiction. Children raised in homes where addiction is present may face emotional neglect, instability, or trauma, which can lead them to use substances as a coping method. When kids grow up seeing substance use as a normal way to handle stress or emotions, they're more likely to repeat those behaviors. They may also struggle with mental health challenges inherited from their parents, which increases the risk of addiction. While the link between parental addiction and risk in children is strong, experts agree that with early support and healthy influences, it's possible to break the cycle.
What are the impacts of substance use in pregnancy? The use of illicit drugs while pregnant may cause or even increase chances of a miscarriage, stillbirth, preterm labor, or even a birth defect. Not only illicit drugs, but also alcohol, smoking, and even abusing the use of prescription drugs while pregnant is harmful to you and the baby. You can also get withdrawal symptoms in the baby after birth, as well as an extremely higher risk of SIDS. Women who inject drugs have higher chances of contracting HIV and passing it down to their baby. Using opioid drugs, often pain relievers, can cause withdrawal symptoms in newer babies, such as neonatal abstinence syndrome. Most signs of NAS happen within 72 hours of birth, but that's not always the case, and it can happen up to a week after birth. Most common symptoms are tremors, seizures, nonstop crying, difficulty in gaining weight or not eating, fever, trouble sleeping, and even more. Not every baby is going to get all of these symptoms, and maybe even more, but symptoms of NAS depend on the type of drug used while you were pregnant, how much you used, how long it was taken, and your baby's gestational age at birth. How does addiction impact children? Addiction affects the whole family. Usually when someone in the family is struggling with an addiction, everyone finds ways to cope with it. But substance abuse causes an unstable family environment, and parents might not be able to support their children or raise them properly. The children might not have been provided with the basic necessities to live and grow, such as food, water, or clothing. If there was nobody there to show them love, they might be insecure, or even what happened to their parents was their fault in the beginning. These children are more likely to have behavioral issues, skip school, or participate in illegal activities. Children of addicts typically make poor life choices as they get older, many of them developing addictions themselves. They may also suffer at school by skipping classes to participate in irresponsible activities that will lead to bad grades and not being able to get a job. Neglected children may also be bullied for not having proper hygiene since their parents chose addiction over supporting their children.